Hi everyone. Today's session is going to be on allergies, and yeah, let's start.
Could I just ask everyone just before we do start to just make sure your microphones are muted, just so that we don't get any feedback. But yeah, as we said, today's session is on allergies. We're going to be talking about some of the ethical issues behind them, and some topics which are of particular relevance today with new and upcoming therapies and treatments regarding allergies.
Okay, so what exactly is an allergy? Can anyone put it in the chat maybe, or just saying, just say what they know about exactly what an allergy is? Any ideas? What does everyone know about allergies so far before we start?
Do you know anything about how they're caused, or what makes them different to regular diseases or anything? Yeah, but please do put your answers in the chat, and then we'll discuss that.
Yeah, so someone said a reaction to a food or substance. That's a good idea. Could you mention sort of, what kind of reaction, what can it lead to, any sort of scientific terminology you might be aware of, exactly how this reaction comes across, any other ideas? Immune system response to foreign substance. Yes, that's a really good idea. Does it always have to be a foreign substance? Can there be allergies to things which aren't foreign potentially? Just to say one or two more ideas, and then we'll actually reveal it. Okay, triggers like pollen can result in allergic reaction and cause symptoms like sneezing or swelling or rashes. Yeah, exactly. Allergens is the key word that I was looking for. It could be a range of things. Allergies are a number of conditions caused by hypersensitivity of the immune system to typically harmless substances in the immune system. Common allergies include hay fever, food allergies, asthma, etc. And these can be caused by allergens such as pollen and certain foods like peanuts. That's a very common allergy. 40% of the world's population suffers from allergies, and this number is actually increasing. So, that's just an overview of what exactly allergies are, but it's very important to realize that quite a huge proportion of the planet has allergies, and typically the allergies are used to describe something which is, something that's not harmful in everyday use. So it's a hypersensitivity to something that doesn't need to be there.
Yeah, and I think that's what differentiates allergies, or rather allergens, from regular antigens. The fact that allergens aren't necessarily harmful, but it's just the body reacts hypersensitively to these allergens. And so we're going to talk a little bit about the kind of scientific reason for that. Some of you may have heard of B cells, which are a type of white blood cell, and these, of course, will produce antibodies specific to certain antigens found on pathogens. And so that's how we can recognize pathogens that cause disease, and how our immune system is able to fight against those. But the immune system can also produce antibodies complementary to allergens, despite them not being harmful. And scientists don't actually know fully why we do this. There isn't a known scientific reason why allergies exist, or why we have this hypersensitivity. But what essentially happens is that the immune system treats these allergens as a threat. When someone is first exposed to an antigen, the immune system produces immunoglobulin E antibodies, which attach to immune cells called mast cells, which then release enzymes to fight infection. So you may have heard of histamine before. It's one of these enzymes which induces some of the symptoms caused by these allergies, which include dilation of blood vessels, increased mucus production, causing symptoms like a runny nose. Other enzymes like tryptase can lead to anaphylactic shock. You may have heard of this before, anaphylaxis, which is often fatal and is caused by a huge variety of severe symptoms such as difficulty breathing, vomiting, but there are many others, restrictions of the throat, etc. And people who have allergies will sometimes carry EpiPens or other medications on them, which contain, so EpiPens, for example, contain epinephrine, which is a form of adrenaline which can alleviate some of these symptoms. So this is, when we've got a diagram here which shows a little bit, shows how it works with these antibodies and the allergens causing the release of these histamine enzymes, which induces this response.
Yeah, and just looking into exactly what causes allergies, we did talk about allergens, but it's basically allergies have a huge genetic component. There is on average a 33% chance that a child will inherit allergy-causing alleles, and this increases to 70% if both parents have it. These alleles do not cause allergies, but increase the chance of developing them. So it's not certain if two parents have a certain allergy that the child will get that allergy. Gene therapy could be used as a possible cure for allergies, and researchers on Australia have been able to cure asthma in mice by turning off the immune response caused by allergens. And we talked about gene therapy in last week's session actually as well. So if you want to learn more about that, it's very important that you can actually look at that session. But what ethical issues could gene therapy for allergies actually lead to? Just to recap, gene therapy is actually used to change a certain gene. Which can actually change a huge amount about a certain person, because obviously genes govern the entire physical and sometimes the personality traits that we have. So if by gene therapy we can change someone's allergies, what kind of ethical issues could that lead to? Could lead to parents wanting gene therapy for other traits such as eye color and so on. Yes, that's not a bad idea. I feel like that's you are correct. I feel like that's more of a ethical effect of gene therapy in as a whole, rather than specifically for allergies. But you are correct that, if they think that it solves allergies, it may help us others. Some people might regard it as playing God. Yes, exactly. That's one really, really good point. Yeah. So if some people believe that if you're born with an allergy, some people might believe the idea of being able to overcome it could be seen as playing God, and that, if you're born with any sort of allergy, you should live with it, because if they believe in God and if they believe in this, they might believe they should, they've been given this by God, they should live with it. Is gene therapy risky at all for the child? That's true. So gene therapy at the moment is actually highly experimental, and there's no form of gene therapy which is completely safe. And so actually it's not used as a treatment yet. At the moment, it is very risky, and I'm guessing, in the near future, it will still be very risky to use on people, which is an ethical concern. This is rather far-fetched, but people could choose to become allergic to things that are good for them. Example, vegetables. Yes, exactly. That's possible. I didn't think of that actually, but I suppose it is possible. Some people might use it as an excuse to become allergic to things that they might not want to consume. But I agree. I think that's a bit far-fetched.
Yeah,
Shivas?
and I was thinking that that idea could also have a large economic impact. If many people are choosing to, well, become allergic to certain foods, or it could be a trend, social trends, that kind of thing, and that could obviously lead to huge impacts on these markets for nuts, for various fish, or any things that people are commonly allergic to. And of course, there will be, as with any kind of experimental technique like this one, there will be a divide caused by people who are able to obtain it and people who aren't. And that's not something which is exclusive to gene therapy, but also other, treatments, experimental treatments as well. Oh yeah, someone's just put that in the chat. Some people will have access to it, while others will not, including inequality. This is something we see come up quite regularly on these sessions, because that is one of the biggest ethical issues, really, inequality, and that obviously links to the justice pillar of the four pillars of medical ethics. Many people consider these treatments, they should be available for everybody to access equally, and if there is a cost involved, which there often is with these, then that can mean that certain patients aren't able to access these treatments. Yeah, so I think we should move on then. Sinan?
Yeah, so we're going to talk about trends in allergies for a bit. So studies have shown that the incidence of allergies is increasing. So more and more people are becoming allergic to things. And the reason for this is because of the hygiene hypothesis, which we will talk about. And as I said, it's especially in the developed world. Reports of food allergies among children in the US have increased by 20% from 1997 to 2007. And obviously, food allergies are a very difficult one because the amount of and the variety of things that we consume is so huge as humans. The idea of food allergies could be very difficult. There have been numerous theories as to why this has taken place. Some scientists believe that increased air pollution is to blame, so carbon dioxide and sulfur dioxide levels can increase the chance of people having asthma. More recently, the theory of microbial deprivation, or the hygiene hypothesis, has been used to explain this trend. Because the world is getting cleaner, we're exposed to less microbes as a result of this, so we are less immune to certain amounts of microbes, possibly. And like it says here, this model suggests that children growing up in wealthy, developed countries are exposed to cleaner environments and spend less time outdoors, which means that they have less allergies, or they have more allergies because they're exposed to less allergens, sorry. This is supported by several theories. A Swedish study showed that farmers' children who had regular contact with animals before the age of 7 and drank unpasteurized milk didn't develop as many allergens as children who lived in the city. The extra IgEs are at their highest level before the age of 10, but can drop after this. This means that children may lose their allergies as they become adults, which means that it's possible that they might become allergen immune when they're older, but especially in the developing world, it seems that allergies are increasing in number and frequency. So just thinking about what we've talked, should we expose children to allergens to prevent them from obtaining allergies? Is this ethical? Now, this may seem like a pretty easy question at first, but think about it because it does have both positives and negatives. So what does everyone think?
So I think when you're answering it, because this obviously links to microbial deprivation, exposing children to allergens would perhaps prevent them from obtaining these allergies. But at the same time, sanitation has been proven to be so effective at reducing the chance of other diseases spreading. Is that trade-off really necessary? Is it worth it to prevent allergies from happening if we can also prevent if that means we can't prevent other infectious diseases from spreading?
The other thing is, has anyone heard of what prospective studies are? So while people are thinking of answers for this question, prospective studies say that if you are trying to maintain or trying to establish a relationship between two variables where one variable is harmful to the subjects that we are talking about, so for example, the effect of smoking on humans, you can't give people cigarettes. So you can't give non-smokers cigarettes to try and see what the effect is. You have to choose people who already were smoking and follow them. The reason for this is because it's highly unethical to give people something which you think is harmful. And we know that smoking is harmful to the body. So it's completely unethical to give people to give people cigarettes, possibly give them a habit and make them destroy their lungs and cause them harmful effects. That's why you have to use people who are already smoking to try and get that point across. The same idea with I will read the points in the chat in a few seconds, but it's the same idea with monkeys when they're used as test subjects. Quite a few times it's seen as very unethical where we're trying to give monkeys emphysema or in nicotine addiction studies, cocaine addiction studies, etc. You have to give them these drugs to make them addicted, and then you see the effect on their bodies rather than, because they would never naturally find nicotine or take cocaine. And so it's seen as very unethical because you're effectively killing these things off. Someone said, I think that most children are naturally exposed to allergens, such as going to nursery to be exposed to outside germs, but there is a difference between naturally encountering allergens and taking a child to the doctor to be exposed to allergens, which is probably unnecessary, as the immune system of the child will encounter the allergens in their own time. So that's interesting. Rather than the ethical side, you've looked at, it's possible that they're going to encounter this in the future anyway. And I think that's a really interesting idea because, for example, let's say you're a wealthy family living in London and you have access to good healthcare, good hygiene. Do you think that they would necessarily encounter allergens or or microbes in everyday life? And while you're thinking about that and responding, I'll just read some others. Someone says it could backfire and cause serious harm to the child. Yes, exactly. So that's one of the major points, is that you might, kind of like a vaccine. So you would think a vaccine is completely harmless and you're doing it to prevent further harm in the future. But sometimes if people have really weak immune systems or underlying health conditions, it can actually worsen their health conditions by giving them exposure to a certain a vaccine, or a weakened version of a pathogen, which is what a vaccine is, or potentially an allergen. So it's very important to realize that while you might be trying to prevent further damage in the future, you might actually be causing them this damage by using these preventative measures. Someone said, I agree, it could backfire and affect the body in a negative way. Yes, exactly. That's very important.
Mhm. Yeah, and I think it's very important to note, what you said before, about the idea of not inducing these kind of things on children, not forcing them to live in unclean environments in order to, test for whether it has an effect, but instead looking at children who already live in these environments. So, it's a difficult thing to judge and a difficult thing to trial. And that's where some of the ethical issues lie, of course. And so, as someone said in the chat, many people don't believe it's worth exposing children to these different environments just to try and see whether it would have an effect on their ability to develop allergies when it isn't necessary. And I should, yeah, so, but I'd like to point out a study that I was reading about a bit earlier, which took place in the 80s, I believe, in Germany, which was then, of course, divided into West and East Germany. And they measured the proportion of children who had asthma in both countries. And they found that although air pollution was worse in East Germany, there were fewer children with asthma in East Germany, and that's because the air in West Germany had more, because there were more cars in West Germany, there were more pollutants like carbon dioxide, sulfur dioxide, and these chemicals specifically were linked to the incidence of asthma. So it's an important thing to note that these treatments, these studies, aren't always, they don't have a clear link between the incidence of allergies and different risk factors. But of course, they are quite difficult to measure and quite difficult to undertake, especially in today's society. So yeah, I think we should move on now and talk about the treatment of allergies, which we've touched on before. But immunotherapy is one of the main ways that allergies can be treated. And this is kind of slowly building up exposure to an allergen, starting with small doses. And this reduces the number of IgE antibodies, which we talked a bit about before, and increases the number of a different type of antibody called IgG antibodies, which don't bind with immune cells, mast cells, but they will bind with antigens directly, meaning that enzymes like histamines aren't released. And regular exposure to these can lead to side effects. And this is why there is some concern surrounding this kind of treatment, because again, they're often undertaken on children. So I think a lot of the answers to this question will overlap with the last one. But is it ethical for immunotherapy trials to be carried out on children, considering the risks involved? And should we carry them out on children, or since there is a risk of side effects, and even if something goes wrong, potentially anaphylaxis, potentially side effects of the allergen itself causing an allergic reaction. So do you think that's something we should allow, or should we try and pursue any alternative measures or alternative ways in which we can treat allergies? Someone's asked, what would be the substitute for children? That's an interesting question. Does anyone have any ideas about how we could, another method in which we could try and build up exposure without exposing, children to immunotherapy? I don't think there would be one apart from the kind of natural resistance we looked at before. Someone said children can't really give that much informed consent depending on their age, so I'm not sure if it's ethical. That's a very good point. Often these decisions would be made by the parents, especially if children are very young. So that raises a concern as to whether children want to undergo these trials or not. And because, as we mentioned before, allergens, most of the antibodies for these allergens are built up before the age of 10. This is one of the reasons why it's so important to test on children. But at the same time, are the risks really worth it? Someone said the doctors will probably consider the severity of the side effects versus the severity of the reaction without the allergens, but I still think it's an unnecessary risk when it comes to the side effects of exposure. Okay, yeah, that's an interesting point, and I think that's why immunotherapy is quite restricted, especially when the side effects aren't so well known and when there have been documented cases of children having severe side effects. Because we know that allergies can be treated in other ways, even if they can't be prevented. We know that EpiPens can be effective at stopping the symptoms of anaphylaxis. We know that avoidance is the best way to ensure that people don't have allergic reactions. Just ensuring that you don't have a diet that has any nuts, for example. And so these other methods are probably safer in the long term than trying to build up immunity where it could be risky and potentially lead to even worse consequences for children. So yeah, unless anyone has any further points, perhaps we should move on. Oh, we've got another comment here, which I'll just read out. Someone said, I agree, but there is a better and far more safe measure to test children for allergens rather than the traditional one. I ask this because if you randomly have a child who is allergic to peanuts and you don't know that, and he spreads peanut butter on his sandwich, he would run through a shock which might turn fatal if he doesn't get an EpiPen because the parents might not know what to do. Okay, I see what you mean. So, if we don't build up immunity, if we don't have the ability to easily test or identify these allergens, then it could be too late to treat them when they do happen. And we'll look at a case study in a second where that's the case. But that is one of the risks, and that is perhaps why testing for allergens is so important. There is a difference between testing for antigens and for allergens and trying to build up, trying to prevent them. So perhaps we could invest more in testing rather than preventative measures because of the risk that preventative measures have. Someone has correctly mentioned there is a type of patch test for allergens. There are various tests for nut allergies that exist, and these are generally quite safe. And these involve a very small amount of the allergen and generally carry a very low risk as opposed to these more experimental preventative measures. So perhaps that could be a solution to this problem. We should focus more on testing and ensure all children get tested rather than attempting to prevent these allergies or try and treat them.
Yeah. Also, I don't know if anyone's seen an allergen test or an allergy test. It's actually really interesting because what they do is there's a sheet with sort of wells on the sheet, and this sheet has different allergens inside it, and it's placed on your back normally for a extended period of time to see what flares up any allergies inside you. And it's actually really interesting because sometimes it's criticized because the wells are so small and the circles of each allergen are so tiny. They might think that there's overlap, so it's not easy to read. Some people also think that because it's so small, even if you have an allergy, due to the small amount of the dosage of an allergen, it might produce a false negative, etc. So it's very, very important to consider that not all testing processes for allergies or for anything aren't exactly 100% effective or true.
Mm-hmm. Yeah, that's a very important point to consider. And especially when there are false results for tests, that can be very dangerous, especially in a medical setting, when people can be allergic to anesthesia, when people can be allergic to certain types of antibiotics. And we'll look in a couple of slides' time at the effect that can have. in medicine. Yeah, someone's just made a comment. I think if the testing helps us to improve and enhance the current immunotherapy, it would help us to save many more lives in the future. Yeah, I agree with you, and I think that's one of the one of the advantages of testing. If we are able to test children test children whilst also being able to undertake these trials, that could help reduce the risk um, of immunotherapy going wrong, and therefore allowing us to practice it and trying to create preventative measures for obtaining these allergies without posing too much of a risk to children. Yeah, okay, I think we should move on now. We've got a little case study here that Sudan's going to go through, and then we'll discuss it a little bit.
Yep, so Dorothy, age 86, comes into your hospital complaining of chest pain. After undertaking several scans, you find what you believe to be a blockage inside her aorta. Immediate surgery is required to remove the blockage, but Dorothy tells you that she has had a surgery before and is not allergic to any anesthetics. During surgery, Dorothy is given anesthetic drugs to desensitize her of the pain of the operation. At first, the operation goes smoothly, but midway through surgery, her hands start swelling up and her throat begins to constrict. You are forced to stop surgery and treat Dorothy's allergic reaction. Despite your best efforts, Dorothy goes into anaphylaxis and dies shortly afterwards. It is established that although Dorothy had never experienced any symptoms before, she was in fact allergic to the anesthetic. So who was responsible for Dorothy's death here? There is often a long waiting time for allergy clinics in the UK. This means that people are often not aware of allergies they have. How could this issue be resolved? Does anyone have any ideas? Who would be responsible for Dorothy's death if she said that she did not have any allergies and she had never come across this this allergy to the anesthetic before in her life? The doctor did in fact stop to try and treat the allergy, but it was unsuccessful. Who would you say is responsible in this case?
Or is anyone responsible at all for this incident?
Any ideas? Or maybe if you're not sure, you could say why you're not sure. Like maybe you're worried you don't know the law about this, etc. Or maybe there's a few people that should be blamed for this. I don't think any singular person is responsible for her death. Dorothy didn't know the specific anesthetic she was given before, and the doctor did ask her beforehand. The anesthetist wasn't responsible either. The team would have worked to treat her reaction. That was something that someone's just said in the chat. Yeah, so that's really interesting. I don't think any singular person is responsible for her death. Okay, why would you say? Okay, let's say, do you think basically that they should have done an allergy test beforehand to each of the anesthetics? Would that have been something that would have been, obviously that would have been helpful here, but do you think that's something that should be done for every surgery? Someone said it should be rechecked. I'm guessing, I presume you mean the allergies should be rechecked. Okay, you say the allergies should be rechecked. How many allergens should they check for? And how would they know that even after checking, 100 allergens, that it's not, that she definitely has no allergies, and it can't be something that's not in those 100 allergens? Is there a specific type of anesthetic that she could and couldn't be allergic to, or one type is used for surgeries? That's a very good question, because we don't exactly know what anesthetic they used, and I'm pretty sure there are different, the different anesthetics will be used for different surgeries. So she may be allergic to some, but not others. And if she's had prior surgery, it may mean that different anesthetics were used beforehand, and that's why she was not sensitive to them or hypersensitive to them before. So it's very difficult to understand, if you have an allergy. It's quite common, actually. I read a study that 90% of us have allergies, but most of us don't encounter them at any point in our lives, which means that, so people who are saying that they're not allergic to anything may be allergic to something, but will never come across it, and therefore, by default, are not allergic. This may have been the case with Dorothy, but she just didn't know that she was allergic to this anesthetic because it may have only been used for people doing surgery, undergoing surgery.
Yeah. Yeah,
Sorry.
sorry to interrupt. But yeah, no, I think what that point is really interesting because we talked in the last slide about the importance of testing and how, it's a solution to the problem of the increasing problems caused by allergies. But at the same time, testing is an inconvenience, especially in an emergency like this. We can assume that Dorothy was brought in and she went, immediately into surgery after the scans. So, is it right for should doctors have to, like Selan said, test for every single allergen before they go into surgery? Because that could lead to risks to her health. Obviously it's an emergency, they need to act very quickly. And if something does go wrong, then, what is the trade-off we need there between kind of speed, efficiency, and, ensuring everything is safe beforehand? We've got,
Maybe if there,
oh yeah, sorry, did someone want to make a comment?
yeah, uh, maybe if there was a way that we could get the details of the surgery that she underwent before and the type of anesthetic that was used in that surgery,
Yeah,
maybe a more detailed interrogation which could have been happened with that woman would have saved her. But as the situation is presented to us, I don't think that anybody is at fault. But maybe a more detailed interrogation of the previous surgery, because anyways, she would have been given the anesthetic before also.
yeah, that's
And
that.
that anesthetic, and if that surgery was a success, it means that that anesthetic worked.
Mhm.
So if we
Yeah.
had a detailed interrogation before the surgery, we could have known about the same anesthetic, and maybe we could have used the same in order to minimize the risk of further allergies or infections or anything. Thank
Mhm.
you.
Yeah, I agree with you. And I think, in a real life situation, we can assume this would probably be quite an unlikely situation. Doctors would ensure that they were using the correct anesthetic, but mistakes do happen. And this isn't, completely something that would be impossible. And you're absolutely right. I think it would be to ensure nothing like this would happen. It's important for doctors to check which anesthetics they've used before, which ones that didn't work, if any. And so, in this case, what the doctor should have done was checked the anesthetic used, despite it being an emergency. They should have, checked and ensured that they were using one which was known that would be safe. But at the same time, there have been situations where patients, respond well to a certain anesthetic, but when they take it later for another surgery, they can have problems. So, there is a problem with that as well, and also false results. So there is always an element of risk involved. And as someone said, doing the tests can be time consuming or expensive. Sometimes they can be quick, but if it's an emergency, then time really is of the essence, and it won't be worth doing all these tests beforehand. Um, yeah, so I think those are some interesting points. So, do you have anything else you'd like to add? Yeah. Okay. So I think maybe we should move on. And this is a similar case study, a similar thing we're going to talk about with the COVID-19 vaccine. And we've had a mostly successful program, especially here in the UK. We've had lots of people being vaccinated with various brands of vaccines. But at the same time, there have been various news articles about people having side effects, blood clots. I think there have been strokes as well associated with certain vaccines. And although the risk of these has been deemed to be very low, there is still, a very small risk involved with them. And, people can be allergic to vaccines as well, or other components within the vaccine. And although only 7 serious allergic reactions have been reported as a result of the Pfizer vaccine, that risk, although obviously that's a very small number, especially when you consider there have been millions of people vaccinated, that risk is still present. And you may remember in 2020 there were 2 NHS workers who had severe reactions to the vaccine. And many people think that this uncertainty surrounding the risk is due to the fact that these vaccines have only been present for less than a year. They haven't been perhaps tested as much as they should be. They haven't undergone long-term trials to see long-term effects and long-term allergic reactions. And that's the cause of some criticism and concern for some people. So now we want to ask, is it ethical for someone to refuse to take a vaccine if they're concerned about having an allergic reaction? And let's say, is it ethical also for someone who has no history of having allergic reactions to refuse to take a vaccine? If they simply say, no, I've read that people are having allergic reactions, I don't think it's safe, therefore I don't want to be vaccinated. Is that a valid concern to have? And should a doctor be able to override that decision? And then secondly, we want to ask, should the COVID-19 vaccine have undergone long-term trials before being released to the public? Or do you think that the situation we're in, the pandemic we're in, means that speed needs to be prioritized over safety? So this is similar to some of the discussions we've had in previous sessions, but we're applying it more to allergies now. So if anyone has any ideas, please do put them in the chat. We've got someone saying everyone has the right to decide to take the vaccine or not, no matter their reason. Their autonomy is still the most important thing. So I think as long as we educate them on all the risks, it's ethical for them to decide. Yeah, okay, that's an interesting point, and that's kind of the main argument that people give when you're regarding autonomy and a patient's ability to make their own decision regarding their treatment. Many people think that it should not be a doctor's place to decide if people are putting a foreign substance in their body, and many of the concerns people have about the COVID vaccine are valid. And someone said a kind of counter argument. Someone said herd immunity would help the minority who refuse the vaccine. Yeah, that's very true. But at the same time, it could be harder to reach herd immunity if there are fewer people taking the vaccine. And if there is skepticism surrounding the vaccine, then that could, of course, lead to less people having herd immunity and more people becoming infected, especially vulnerable people. Someone said comparing the risk of severe illness or death from getting COVID to the risk of allergic reactions from the COVID vaccine, it's definitely ethical to continue recommending the COVID vaccine before long-term trials have been done. It will save more lives this way, as the world is still carrying out trials and monitoring all cases of reactions. Okay, that's an interesting point. So you're saying that we should allow these vaccines to be in place for the greater good because they have an overall larger societal benefit than the individual costs, i.e. the individual people who are having these severe unexpected side effects. Someone else has said, yes, I think it should be a personal decision on whether the patient wants to take the vaccine. On the other hand, I agree that there should have been more testing. However, we are in such a desperate situation. I think it was viable for the vaccine to release with less trials. Okay, yes, I think many people share the same.
Excuse me, can I add a point?
Yeah, of course.
Yeah, I was thinking, basically when we are administering vaccines or drugs, we look at a very important point, that is the risk-benefit ratio. And considering the paucity of time that we have during this pandemic, the risk, the benefits are outweighing the risks that we are having in case of these vaccines. Since you already mentioned that there are only 7 serious allergic reactions that happened, and that were draftily reported about this vaccine, the benefits do seriously outweigh the risks. So this is something that the pharma companies and the big companies, they take up in their mind before putting out anything. So shouldn't we consider that as well as physicians?
Yeah, thank you. I think that's a very interesting point, and I think most people will share the same consensus. That the benefits outweigh the risks. But linking to the first question we've got on the PowerPoint here, is it right for people who don't, whose concerns might not necessarily be genuine, if they don't have any history of an allergic reaction and they're just very skeptical despite the known benefits of the vaccine, is it right for those people to be refuse the vaccine? I think most people will argue in favor of autonomy, but it's a valid concern and a valid debate to be had nonetheless. Someone said, I think COVID vaccines should have been trialed properly, but it was an act of desperation in a way because we needed a solution and fast. Typically, vaccines take a decade or more before approved and released for use. So this vaccine was definitely an exception. We can't know for sure the long-term effects of this. So people should have a right to know the benefits and risks of taking the vaccine or not. Okay, yes, and I think that's a very interesting argument and a very valid one. You know, whatever we know that the news, the media is reporting the risks that come up with the vaccines and the people who have experienced severe unexpected side effects. So it's important that the public is informed about that, and we're not just saying, you know, the vaccines are perfect and trying to persuade people to take them. Of course, we should be highlighting their benefits, but at the same time, people should still be aware of the potential risks they have, and then they should be able to come to their own decision as to whether they want to take it or not. Siddhant, do you have any other points you'd like to add onto that?
No, I think it's been pretty covered in this slide. Yeah.
Okay, cool. So I think we'll move on then.
Yeah, so we're going to talk about hay fever vaccines, and the pollen allergy is actually one of the most common allergies in the entire world. Hay fever is caused by an allergic reaction to pollen, and it occurs in 12% of British people. Most people manage symptoms, including sneezing, itching, and coughing, using over-the-counter medications. People with more serious symptoms can opt for a steroid injection. But this suppresses the body's immune response to histamines, and also the injection is no longer available on the NHS. This is because there is not enough evidence supporting its long-term efficacy, despite studies showing that it can be effective. It is still offered privately. It also has several side effects, including high blood pressure and rashes. So therefore, should a hay fever vaccine be reimbursed within the NHS? And with the vaccine, we're talking about the, there isn't a vaccine at the moment, because obviously the idea is a vaccine is something that you've not been sensitized to before, or something which would not cause an allergic reaction within you. Allergies are very different because these are not typically harmful things. So most of the planet would not, most people would not find this harmful, and therefore would not start a immune response to the introduction of this thing in your body. So it might be a bit different. But ethically, should a hay fever vaccine be reimbursed within the NHS? Also, what are the pros and cons of investing into vaccines for allergies like hay fever? Does anyone have any ideas? Feel free to talk out loud if you want to. Otherwise, please put your answers in the chat. Anyone have any ideas? Think about, maybe the costs, ethical ideas, how testing would occur, how it would be mobilized, how more people would access the vaccine, what exactly the vaccine would have inside it. Someone said 2 members of my family have hay fever and they hate it. I'm pretty sure they would appreciate a vaccine as long as it is trialed and deemed safe to use. Yes, I agree. And actually, most people do have hay fever. I have someone in my family who suffers from it as well. And it's very difficult because hay fever is something that it's quite easily triggered. Not only that, but it lasts for a long time, especially when summer rolls around. It can be quite difficult to deal with for an extended period of time. So maybe people would appreciate a vaccine if it were there and if it were considered safe to use. Someone said, yes, the NHS should offer treatment and prevention to allergy and hay fever symptoms accessible to everyone. As that is part of their aims in keeping a healthy population. I'm not sure if that's what you're asking. Someone said, right, so just to break that down a bit, I mean, yes, we are asking if they should offer allergy alleviation and if they should be helping with preventing allergies. But think about this. Should they invest money in a hay fever vaccine? Because that's quite different. Not just treating symptoms, but a vaccine. If there was a readily available hay fever vaccine, the NHS should aim to make it accessible to everyone. That means a low cost and easy to get. Yeah, okay, exactly. So lots of people are agreeing with this, that if there was a vaccine available, if it was tried, tested, and actually working, it should be available to use. There aren't really any harmful risks of hay fever, and even though the actual hay fever can't be treated, the symptoms can be reduced. This is the current situation. Yes, because the symptoms aren't exactly pleasant, and lots of people do suffer from it, and it could be alleviated. Someone said, so money should be put somewhere else. That's interesting, because would you say that it's important to treat something that possibly isn't so harmful, but a lot of people have it? Or is it more important to treat something that's very harmful, but very, very few people have it? Where should the money go? which is more important to invest money in? Someone said, do you think that hay fever is considered serious considering how common it is? Exactly. So that relates to my question a few seconds ago. Is it more important to invest money in something that may be not so serious but very, very prevalent? Or is it more important to invest money in something that may not be so prevalent but very, very serious? So for example, something that's not very common is maybe blood disease or specific types of cancer, which are very, very rare, compared to, for example, hay fever. Is it better to spend more money on alleviating, finding a cure for blood disease and specific types of cancer, or is it better to find a cure for hay fever and a vaccine for hay fever? Any ideas?
Can I just add, I think I actually think this is a very interesting discussion that we're having, because hay fever is different to a disease like coronavirus, for example, or HIV or something. It's not really a disease at all, because as someone said, there aren't any harmful risks of hay fever apart from a few very specific cases. Hay fever isn't pleasant. I have hay fever myself, and although now I have good medication for it, when I was younger, I know that it caused a very bad effect, with your eyes, they can swell up, sneezing, your throat starts to close up, and it can be very, frustrating and painful even. But it isn't life-threatening. And so many people would argue, as someone's mentioned before, is it worth investing money into a hay fever vaccine when there aren't any really harmful effects? Or should we spend that money somewhere else? Should we try and invest it into an HIV vaccine instead, or a coronavirus vaccine, or something which we know will stop people from getting truly harmful diseases that can have a really damaging effect on their body, and can be, in most cases, fatal? So, that's an interesting decision to make. And also with regards to the NHS, the NHS obviously relies on public money, on money that's brought in through taxes. Is it right for the public to pay for or contribute to the payment for a vaccine for hay fever when this money could be spent elsewhere on conditions that are more serious? So it's an interesting discussion. But of course, we can look at the benefits of reimbursing it into the NHS or into public health, is obviously that these vaccines would be deemed safe, and they would go through proper clinical trials, which would mean that they would be safe to use, accessible to all people in most cases, and that could really help the few people for whom hay fever is a big problem.
Someone said in the chat, I think if it's common but not very prevalent, it will always have a risk of exaggeration and cause other problems. It is better long-term, to my point above. Someone's also said that NHS is also spending way more money in treating people with HIV, for example. So if you prevent that, then they could save money if the vaccine is created. Yes, exactly. So, the idea of treating something which may not be so serious, but is more prevalent, is maybe it's better to possibly treat something that has a chance of becoming much more dangerous than something that may be prevalent but not so serious, because that in the long term, it's a lot better if that gets helped, because the thing that's not so serious can actually be sort of postponed because it's not causing harm. It is irritating and it is uncomfortable, but the idea that it's not life-threatening is quite important to consider possibly. But yeah, I think that pretty much covers the ethical points we're trying to make in this slide.
I believe that the amount of investment in the terms of funds that you are, contributing to any pharmaceutical industry will eventually happen. The reason is that if you are not investing in the IgE antibody vaccines for these allergies, you would be investing later on in the companies that are making the antihistamines. Because if right now vaccines like these come up, then the people to whom you would be administering these vaccines, those people would later on, they won't be in a situation to buy those antihistamines, which they always have to keep in stock in their bags, because whenever they go out and they can have an allergic reaction. So if we are, investing money right now into a program that's creating vaccines for now, I agree to the point that making an HIV vaccine or a coronavirus vaccine right now is of utmost importance and is our primary concern. But taking the research for these vaccines also slowly and steadily, along with the research of more driven programs, could be an investment for our future healthcare. Don't you think so?
Yeah, actually, that's a very interesting point that you've made, and I do agree with what you said. I think that there are advantages and disadvantages to this, which should be considered, and that's why we're having this debate. It's important to note that even though the idea of having a hay fever vaccine might sound ridiculous at first, it could offer more long-term benefits to the healthcare system. And that's an important thing to consider. So yeah, thank you very much to everyone who's contributed in this slide. But I think we'll move on now, and I'm conscious of the time as well, so we'll just this is the last slide, I think, about penicillin and allergy tests, which is something we talked about right at the beginning of the session. Penicillin, as I'm sure you all know, is a common antibiotic used to treat certain bacterial infections, pneumonia, and meningitis, for example. However, there are a small minority of people who are allergic to it, and this, of course, as we know, can lead to anaphylaxis. Although around 10% of Americans report a penicillin allergy, it is thought that the true number is much lower. And this is due to a variety of reasons. Firstly, due to people losing their sensitivity to penicillin. As we mentioned, people can lose their allergies over time, and this is particularly true for penicillin. And also misdiagnosis. If people have penicillin, they can have certain side effects which aren't necessarily reflective of a severe allergy. And penicillin, although there have been some problems with antibiotic resistance with penicillin, it is one of the most used, if not the most used, antibiotic in the world, and it is used to treat many diseases. If patients falsely declare that they have a penicillin allergy, a doctor would have to find an alternative antibiotic, which of course can be costly. It can contribute to antibiotic resistance as well and can be less effective. So the final question we want to ask is, should it be compulsory for a doctor to complete an allergy test before treating a patient? We talked a bit about this earlier, but especially in emergencies when doctors don't have enough time, perhaps, should it be compulsory for this to happen? And what issues could this lead to with regards to autonomy, with regards to safety? So yeah, if anyone has any final points regarding that, then please do put them in the chat and we'll discuss them. Maybe while people are thinking, Sinan, I wonder if you have any comments regarding this?
I think, especially with the first question where it says, should it be compulsory for a doctor to complete an allergy test? I think it should be. I think it would be a good idea, because even if the test is not completely 100% accurate, it is still used as an allergy test. And say it does come across that they're allergic to a certain type of antibiotic, such as penicillin, or anesthetic, or some sort of drug that the doctor was going to prescribe, it's a lot better because that we have that foresight and we know that that's going to present a problem. So the doctor is going to avoid making that mistake in the future. I think it is a good idea. I think the only problem is it can be a bit difficult, especially if it does cause an allergic reaction and if the patient feels harm because of it. It may be a bit difficult for the patients to then undergo that allergy test when they didn't possibly need to.
Yeah, and someone said, a similar point, it would definitely help keep the patient safe from potential allergies, but it could be expensive and time consuming and resource intensive as well. Someone said, if we don't do an allergy test for reasons like it being time consuming, especially in emergencies, and an allergic reaction happens, what would the next course of action for doctors be? Is it possible to have preventative measures in place that will treat the allergy as soon as it surfaces in the situation? Right, that's an interesting point, and perhaps that's something we could have mentioned with the case study earlier about the lady who was having surgery. You know, it might be an option for doctors to skip an allergy test in an emergency as long as there is a safety net in place, i.e., as long as they're able to treat, you know, anaphylaxis or a potential side effect or an allergic reaction to a drug or anesthetics, for example. So if that is present there, then maybe it shouldn't be compulsory for doctors to complete an allergy test. Someone said if it's not an emergency, I think it's crucial to go through allergy tests beforehand. But of course, you know, that will lead to a huge resource problem. Allergy tests, of course, often require samples of the allergens. This could be a problem with antibiotics, for example, and especially considering the threat of antibiotic resistance. So yeah, thank you everyone for your comments there. Actually, there's one more. I'll just read this out and then we can move on. Someone said, I think it's hard actually. Maybe developed countries won't have a problem doing this, but in places where the public health system isn't that great, those patients could potentially be at risk. I think that's relating to justice here. Okay, yeah, that's an interesting point. You know, it might not always be viable for doctors to undergo these tests, and therefore, you know, certain patients are, you know, they have this safety net before they go into surgery, for example, whereas other patients don't. And that's again one of the issues that exists with regard to inequality between patients. Yeah, Siddhant, do you have any other comments you'd like to add?
No, but you know, I think it's interesting that currently we do not have. I don't think there's a prerequisite for doctors to conduct an allergy test every time that they've admitted a patient and they're going to prescribe a drug. But it's interesting to see why possibly they should or why possibly they haven't.
Mm-hmm. Okay, right. Well, I think we've more or less finished. We're not going to talk about alternative medicines. We did mention this in a previous session, but it's just some of the issues surrounding alternative medicines that are used to treat allergies. And of course, many of the issues that we've mentioned before do link to this in regards to safety with trials being undertaken in the UK health system. But yes, please do check out our other session on alternative medicines if you'd like to learn more about that. But yeah, we've more or less finished our session now. So thank you everyone for attending. We hope you enjoyed it. Please do contact us on themedicaldebate@gmail.com if you'd like to send us a message, ask us a question about anything. Please do follow us on Instagram as well on The Medical Debate. And also we have a YouTube channel called The Medical Debate, where we'll upload all our videos for our sessions. You can check out previous sessions and send us a comment if you want to ask anything more. So yeah, thank you everyone for attending. We hope you enjoyed, and we hope to see you again next week.
Yeah, you can find our YouTube channel by just typing in The Medical Debate on YouTube, and you'll see all our previous sessions. This one will be uploaded by the end of today as well, so you can access all our previous sessions, all the recordings. But thank you very much for coming, and hope to see you guys next week. Feel free to tell other people about our sessions and how they can join. Share the link around, tell people about their Instagram, the YouTube channel, and the email. Feel free to get as many people as you want to join. The more the merrier. But thank you very much for coming.